Battlefield medicine has improved rapidly due to its importance. Not only did treatments and wound care improve, but also forms of transportation and technique systems.
In the Army, there are medical soldiers known as combat soldiers, and they're known as 68Ws. Their purpose is mainly to run to a wounded soldier when they are injured in a battlefield, and their first response is to treat any vital trauma wounds and to check for safety, and if there is any possible future treatment needed, that they get it as soon as they can.
In August of 1862, a system of ambulances and trained stretcher bearers designed to evacuate the wounded was created. Jonathan Letterman, the medical director of the Army who created this system, created another system to care for the wounded. This system had levels of care: the field dressing station, the field hospital, and the general hospital. Another system established during this time was triage. All of these systems remain a basis in the military today.
So, in order to treat a patient, there is a triage known as MARCH that they follow, and MARCH treatment begins with looking for any major hemorrhaging, any bleeding, followed by making sure the airways are working, that people are still breathing, respiration, once again, circulation, and then following to make sure that if there's any hypothermia, for example, caused by any major blood wounds, any hemorrhaging, people can still get hypothermia that way.
Triage became necessary due to the number of wounded soldiers in battles. The wounded soldiers were divided into three groups: the surgical cases, the slightly wounded, and those beyond hope. The surgical cases were dealt with first since they were most likely to benefit from immediate care, and the slightly wounded were treated next since their wounds were not life-threatening. After all of the soldiers were treated, the surgeons would attempt to treat any of the cases beyond hope that were still alive.
So before, when there was a lot of hemorrhaging caused by an injury, the best way to treat it was with applying as much gauze as you can in order to create enough pressure. However, that was not the most effective way, as hemorrhaging was still possible and hypothermia still happened. So in order to fix that, we introduced a thing called Xstat, which is basically a large syringe with tiny little amounts of expandable pellets and within 15 seconds it will begin to expand, creating pressure on the wound in order to help block any severed blood vessels and to get people to treatment as fast as they can. And even though if they do not have that syringe, new gauze such as Hemcon and QuikClot still exist. So one of the most common drugs to treat people in the war was morphine. However, it's not the best thing. For example, if someone is losing a whole bunch of blood and their blood pressure is really low, morphine will already make their blood pressure drop even more. So instead now we use ketamine, which is, instead of lowering the blood pressure like morphine does more than it already has, it will just block sensory motors enough that they will still feel the pain, and they will still feel the pain. The only difference is that they won't mind it, and they'll still be able to fight in the battlefield if it's necessary in order to get to safety, instead of just having the risk of getting hypothermia or possibly getting killed in the battlefield. So soldiers still need to be able to decide between fight or flight, and ketamine allows them to do that, unlike morphine, because the blood pressure drops, and once that does, you are in danger in the battlefield, and you want to be able to flee if it's necessary, or be able to get help, whatever it is that will allow you to continue to survive.
In the military, each squad carries a SCAD or a Talon leader for evacuation, and each soldier carries a hemorrhage control kit, but only certain individuals carry IV fluids. This system allows for each squad to be self-sustaining and increases the supplies carried by the combat medic. With these supplies, soldiers are able to treat life-threatening conditions until more experienced care arrives.